All right, welcome back, everybody. Broadcasting from the secret man lair of the Mad Medic here. We're getting into abdominal trauma. Again, the kind of what we live for in our trauma care, right? Getting to see all those interesting things. The free flowing of abdominal cavity contents, right? By the way, no. Once you see the first time you think you see it, you're like, ooh, cool, and the second time you go, ooh, yuck. Okay, so again, let's talk about some abdominal and pelvic trauma here, the A&P of it, and some of the pathophysiology that's involved with that. Remember that it's kind of an exposed area, okay? There's no skeletal structure like in the thorax. Again, you've got a lot of musculature there, but not really that much skeletal structure. Matter of fact, the only real skeletal part is the vertebrae going down through there. So blunt and penetrating trauma can damage vital organs, and you can lose, again, 3 to 4, depending on which book you read, 3 to 4 liters of blood in the abdominal cavity. I'd say 3 in the abdominal, probably 3 in the pelvic. So yeah, you can lose a significant amount of blood through that area, okay? There's been a decline because we've got better surgical techniques. We've got better diagnostics now. Improvement, wearing seat belts, so airbag deployments. So we've got a decline in the morbidity and mortality because of this. But the problem is that if you got a blunt abdominal trauma, again, 50 to 75% of cases have some of this, usually due to crushing or compression or some sort of deceleration injury. So again, kind of a breakdown of the stats here. Again, of what actually gets injured or wounded when we're talking about stabs or gunshot wounds. The thing you got to remember, by the way, if these things break, especially your small intestine, let's just say that they're never on an empty stomach usually, and you get that gastric contents spilling out into the abdominal cavity. Peritonitis infection usually leads to high risk of mortality. So again, let's talk about where it is. It's underneath the diaphragm, going all the way to the start of the legs. The anatomical landmarks is the xiphoid process, the iliac crest, the pubic prominence, and of course the umbilicus. All right, so remember, going back to A&P here, all of these things are located within these quadrants. If you don't know these, you should know these, and if you haven't learned these things, great time to go back and learn these 4 slides. Absolutely imperative that you know what's running through what parts. Nothing like pushing on the right side and going, hey, guess what? Their spleen's busted. And you go, and me as a teacher go, oh, man up. So make sure that you know what it is that's in what cavity, okay? It helps us to determine what problems that they could be having and what actually got damaged, okay? Remember that your digestive tract, 25-foot hollow muscular tube, okay? So it goes all the way from the esophagus all the way down to, goes out the poop hole, okay? Long and short. Again, if things spill outside of that area, probably going to get infected, probably going to cause problems, all right? Now, your spleen, it's got an immunologic function, but it also stores a large amount of blood. So this is what actually you get in the early stages of shock. You'll get a splenic flexure to release that blood back into the system to help maintain homeostasis. All right, your liver, again, is the detoxifies, helps produce bile, clotting factors, again, major things for body metabolism. All right, so it assists in regulation and produces proteins used for clotting. And that's kind of important. So what happens if you've got liver dysfunction? They're probably not going to clot as well as they should, and they're going to end up bleeding a lot more. Now, your gallbladder, again, is a small hollow organ. It releases bile into that's used for fat digestion. And unfortunately, when that bursts, it can cause major problems. Your pancreas, of course, has both the sugar regulation, which is glucagon and insulin, but it also produces digestive enzymes for the body. All right, so our kidneys, again, the genital urinary systems, and these guys, unfortunately, are very exposed. You've got a couple floating ribs over them. Easily get kidney contusions, especially when they're hit in the back. Quote, unquote, the kidney punch, okay? So again, but the ureters go down the urinary bladder and then out whatever appendage it has to be. Now, again, remember that the ladies also have the female reproductive organs in those areas, their uterus, the ovaries. The guys, of course, have their own set of equipment. And again, if you've got pregnancy along with trauma, number one, they go to the hospital. No questions asked. We really need to take you to the hospital, okay? Because we can't see all the problems that might be going on there, okay? So again, urinary system, don't forget about those guys. The kidneys, again, remember that's your pH control. It helps eliminate excess water from the system, and it maintains blood pressure as well, okay? So by the way, if you've got a hypovolemic patient, probably guess what's going to be one of the first things to shut down? Kidneys, all right? Again, the uterus, again, remember that the pregnant uterus, by the second trimester, it's actually starting to displace the abdominal contents. And we talked about that in OB in earnest there. But remember, we got two basic problems, and then you got all this stuff that's compressed and pushed back. And again, by the way, week 32 until the end of the pregnancy, the uterus filled. And pretty much the ladies can't eat as much, all right? Simple, long, and short. There's just no space for it, all right? Remember that pregnancy raises circulatory volume by 45%. We talked about this. By the way, their heart rate usually increases 10 to 15 beats a minute, and their cardiac output is increased by 40%. What does this do? It masks all of our lovely signs of hypovolemia, okay? Now, so again, remember that you've got, they increase the vascular volume, they just don't increase the red blood cells, okay? So you get a relative anemia because of that, all right? But the problem is if you use fluid resuscitation, remember, you don't have the oxygen carrying capacity in the blood in which to do that. Now, the last trimester, again, is usually full size, and it actually can compress the vena cava, so keep that in mind. We talked about that during OB. Your vasculature, again, abdominal contents supplied by the blood via the abdominal aorta, and again, attachments to the femoral arteries as well. So the aorta kind of loops around. It goes off to the kidneys. It goes off to the liver. Goes off to the spleen. As it goes down, it's actually going to split off into your femoral arteries. Okay, and remember, if we've got damage down there, we can tear some of these structures as well. Okay. The peritoneum, again, it's a tissue resembling lung pleura down in that area, basically. It's got a lot of mesentery, blood flow, blood vessels, lymph, and the omentum, it covers and insulates the interior abdominal cavity, okay? So that's that layer that's on front. Now, the reason that we make such a big deal about the peritoneum is that what happens when those gastric contents spill out? Well, you get peritonitis, usually a massive infection, and again, a lot of definite problems, okay? Which is, by the way, if you've noticed, a lot of the abdominal surgeries now use a lot smaller incisions. They don't like to just open them up. They'll use them to go in orthoscopically. They have a lot less complications from abdominal infection because of that. Now, we talked about these penetrating trauma. Remember, we got to find out what it is and what kind of object. This is, again, the low velocity stab wound. Again, but can this be causing damage all through this area? Yeah, you bet so. All right. So, again, we got to find out if you get tissue disruption. By the way, 40% they get the liver, 25% the small bowel, 10% get the large bowel. Shotgun blast, usually under 3 yards. Call a priest. You're going to need them. And then the parameter change with decreasing gauge and shot size, okay? So, again, shotgun blast, by the way, usually pretty brutal there. By the way, this will be blunt trauma to the upper abdomen. If I'm looking at this guy, I'm simply thinking, the first thing I'm thinking is liver damage, okay? More than likely something with the liver here. But again, double check these areas, okay? What about this little big spot right here? Make sure that we haven't damaged underlying structures, okay? Shear forces. It causes damage when one part of the organ is free to move while the other one is not. Liver, by the way, spleen, very affected by shear forces, okay? Keep those in mind, all right? 40% are splenic, 20% are the liver, and again, it can tear all of these structures, by the way. Your abdominal wall trauma, again, usually it's an ecchymosis swelling and it requires hours to develop. So if you're already seeing changes in color, warmth, that's usually a not good sign for you, okay? By the way, an evisceration. This guy's an evisceration. Yeah, it looks like the sausage coming out. Again, wet, sterile dressings over the top of that, surrounded by a dry dressing. Again, you want to keep these guys moist, okay? Yes, they're going to have to stick them back in. We're not going to do that for them. They're going to do that at the hospital after a nice washing, aka lavage. Okay. The abdominal, again, penetrating injuries, they can end the abdomen. Remember, by the way, think about what direction it went, especially the upper abdomen or lower. Could it go and affect other structures? Okay. So knowing your anatomy here, good, especially if it goes in the upper quadrants and there's a stab wound there. Did it actually go through the diaphragm? And that can disrupt the abdominal cavity as well. Okay. Hollow tears, again, remember, stuff's going to leak out into those areas. And again, you might get frank blood in the stool, blood in the emesis, or blood in the urine can occur because of that. Your solid organ injuries, okay, usually the bruising goes along with that as well. If the organ capsule's intact, the hemorrhage is actually kind of limited. Problem is usually the organ capsule doesn't stay intact, okay? And again, you can get unrestricted hemorrhaging occurring because of that. Spleen, by the way, can bleed profusely. Splenal injury. Again, the good news is you can live without your spleen. Splenectomy is usually something that it's kind of a meat and potato skill for a trauma surgeon, okay? But if they've got that, they can actually take that sign. So the blood loss may accumulate against the diaphragm and cause left shoulder pain. So if you're seeing that and you're hearing that, we call that Kerr sign. Kerr sign is something you might want to remember later on. Okay. Let's see. We talked about all these guys. Yes, we did. So vascular injuries, remember that we can tear vasculars, and this is usually associated with a penetrating trauma. They have to go in and suture these back up, suture it back together if it didn't completely, totally split them. Rate and volume loss is do not slow initially, so usually you get more and more bleeding as the swelling, and it becomes very notable. You can have mesentery and bowel injury. The mesentery, again, is that network kind of blood flow that helps absorb everything in the abdomen. Blunt injuries, usually it stretches and compresses it. Again, it can cause ischemia. It can cause necrosis and possible rupture of those structures. The good news is that the mesenteric injuries don't bleed profusely. The problem with that is that they usually end up killing tissue. Okay, so and again, and in penetrating trauma, the omentum is injured and the bowel may be torn away anywhere along its length. Okay, again, multiple leaks can happen as well. Again, peritonitis is the bacterial and chemical irritation to that. And again, a huge problem, especially when you're dealing with abdominal wounds, okay? It's why, by the way, when you go into the trauma treatment areas, they're already starting, if they've got leakage into that area, they usually start broad spectrum antibiotics ahead of time to start to hopefully ward that off. Pelvic fractures, again, serious skeletal injury. You can lose 3 liters of blood into the pelvis, okay? It can tear great vessels in those areas, okay? If there's a pregnancy involved, yeah, it can completely tear the uterus there. It can hurt the fetus as well. So trauma and sexual assaults, by the way, can injure the reproductive structure. So keep that in mind. Yes, ladies and gentlemen, the hand punch to the boys actually can cause major problems, okay? I know that that's kind of a firehouse tradition. We probably should quit doing that. I'm just saying. No, it doesn't work. And by the way, you girls can get that too, so don't think that you're exempt from that. All right. Yeah, you probably shouldn't be touching somebody else's crucial 1%. Enough said. All right. If you got pregnancy, remember, number one killer of pregnant females is usually trauma. And again, 36% of all maternal mortalities is due to penetrating abdominal trauma. Yes, there's people out there that do the red wedding, okay? Yes, they go in there and they stab the fetus. It is brutal. It's very horrible. Shotguns, fetal mortality, by the way, 40 to 70% with a gunshot wound, okay? Trauma patients that are pregnant go to the hospital. Enough said, okay? Very possible that, again, oh, by the way, if we wanted the changing dimensions of the uterus right here of how many weeks we got here, this would be a good example of that and how things get to change. All right? So again, if you get an injury during the pregnancy, again, bladder's displaced, everything's kind of not where it's supposed to be. All right? So again, keep in mind that when you're starting to assess and treat these patients. All right? And again, I can't stress this enough. Pregnant females go to the hospital for evaluation, okay? There's too many things displaced. There's too many ways that an injury can be hidden. They need to go to the hospital, okay? And the biggest problem is, by the way, well, they think that they're okay because, oh, my blood pressure's fine, my heart rate's fine. Remember, there's changes in the vital signs for these guys. Now, that doesn't work, okay? Again, they get checked. By the way, you can also have the release of the amniotic fluid burst the mucus plug. And when that happens, again, you've got some major great concerns there, okay? Remember, these things can actually happen. So what happens when the placenta tears, uterine rupture, and then we get bleeding outside of, again, they're going to be definitely hurting. They're going to be extreme pain at this point, okay? All right. So, again, if a pediatric abdomen is usually very poorly developed, and it leads to increased injuries, especially with the liver, spleen, and kidneys, okay? So, the children compensate very well for blood loss, so you usually don't know it until it's too late. Tachycardia, tachycardia, tachycardia. Watch out for tachycardia, okay? So, we really need to do this. All right. That's enough for the pathophysiology of these guys. We're going to talk about that on the next one. We'll see you then.